Hi everyone. So today we'll be talking about growth and development. These are the contents that we'll be looking at. So how do you define growth? Growth can be simply defined as an increase in size. How is growth different from development? Development is the progress towards maturity. What are the factors that affect physical growth? The general factors that affect are hereditary, sex, illness, race, socioeconomic status, your exercise, hormone, psychological disturbance, and so on. So what are the basic concepts of growth? Concept of growth involve concept of normality, rhythm of growth, growth spurts, and differential growth. So what are the concept of normality? That is, you compare the individual to the normal population. Is he or she within the normal rate of growth? The rhythm of growth is he or she having the normal rhythm that they are supposed to have. That they are supposed to have this much amount of growth or supposed to achieve this milestone. What are growth spurts and differential growth? We'll look into it. So growth spurts are basically sudden onsets of growth that you tend to have. They occur at different times, and they tend to be different, or the growth spurts tend to be different in both males and female. Now, why is this important? Because we need to know the growth spurt or the amount of growth that is there in order to provide appropriate treatment plans. So growth modifications can be done during growth spurts, but after the growth spurt you will have to go for either an orthodontic camouflage or a surgical approach. So what is differential growth? The human body does not grow at the same rate. So human body consists of different tissues, and all of which tend to grow at a different rate. So this is said or explained by two different concepts, that is Kaman's growth curve and cephalocaudal gradient of growth. So what you see here is the Kaman's growth curve. So when you look at it, you see that there are four different types of body tissues. That is your lymphoid, neural, which is your brain, your musculoskeletal, and your reproductive or your genital. So the lymphoid tissues tend to grow up to 200% in the initial years of growth. This is to provide adequate immunity for the individual. Later it is followed by the neural, then followed by S-shaped curve for your musculoskeletal, and the last body tissue to mature is your reproductive or your genital tissues. So what is your cephalocaudal gradient of growth? So cephalocaudal gradient of growth states that there is an axis of growth that tends to follow. So if you look at this image and just compare the heads of the infant or the fetus and the mature adult, you see that there is a decrease in size in the head. So this occurs because there is an axis of growth from the cephalic end to your caudal end. That is, the caudal end will tend to have more growth towards as the years progress. So when you compare here, this is an infant skull to an adult skull, you see how the mandible and maxilla have grown over the years. So how do bone grow, or what are the mechanisms of bone growth? So it tend to occur mainly by two main processes, that is by drift and displacement. So drift basically occurs due to apposition and deposition, and displacement occurs when a unit is moved when the bone is moved as a unit. So the displacement can be of two types, that is the primary and secondary. So on the left here you will be seeing the primary displacement that occurs when the maxilla, or imagine a unit of the bone, is undergoing deposition or increasing in size, because of which it will undergo displacement. It might, if you look at a maxilla, if there is deposition occurring at the posterior surface, it will undergo a forward and downward movement. But now the maxilla can undergo a forward and downward movement due to another reason, that is due to the change in the cranial base. So that would be a secondary displacement. Now we look at the basic theories. So what are the basic theories? That is genetic, sutural, cartilage, and functional matrix theory. So genetic theory, as the name suggests, it deals with hereditary. So the earlier concept was that growth is controlled by hereditary, or the amount we grow is dependent on our parents. But this is an earlier concept. Now the viewpoints of growth have changed. This was given by Alan Brody. Second was the sutural theory. It was put forward by Seicher. So what Seicher postulated was that sutures have the ability to grow, and According to him, the connective tissue and the cartilaginous joints in the craniofacial skeletons were intrinsic part that control the growth of the craniofacial system. Now, these theory had a lot of drawbacks, because when they tried to transplant the suture from one side to another, the tissue did not continue to grow. In cases of cleft where the midpalatal suture is not fused, the maxilla tend to have normal growth even if the palate is not fused. Microcephaly, hydrocephaly, they all had raised doubts about the intrinsic ability of genetic stimulus of sutures. And sutural growth can be restricted or controlled by placing clips or holding them down. The next theory would be the cartilage theory, which is given by James Scott. So Scott postulated that cartilage have a ability to grow. He mainly talked about the nasal cartilage, where he said that the growth of the nasal cartilage was a crucial part that caused the forward and downward movement or the development of the midface itself. So there were a lot of favors for this theory, because the cartilage always had the growth ability in them, but and when you removed them, it also showed that the growth was not occurring properly in those sites. So this is an example where it shows that the patient on the left shows a midface deficiency. So this could happen due to a defect or a cartilaginous defect that could have happened earlier. So then we come to the functional matrix concept, which is the most accepted concept in orthodontics. So that is given by Melvin Moss. So what functional matrix theory basically states is that form always follows function. That is, changes in soft tissue will cause change in the hard tissue. So this is Melvin Moss who had put forward the theory of functional matrix. So functional matrix basically has two main components, that is the functional matrix and the skeletal. The functional matrix itself can be divided into periosteal and capsular, and the skeletal to micro and macroskeletal. So the periosteal matrices are basically your artery, nerves, blood vessels and veins, and your capsular matrix are nothing but the neurocapsule or your orocapsule. So simple idea to understand this is, imagine a brain and the skull. Which would grow first? Would the skull grow and the brain accommodate itself, or would the brain tend to grow and the skull would accommodate according to the growth of the brain? Right? That is the basic of it. So, and the skeletal unit. So skeletal unit, when you look at it, it can be a micro or macro. Macro unit would be the mandible or a maxilla as a whole, and the micro units would be the individual bones that fuse to form a macro unit. That is, in term for mandible, it would be your condyle, coronoid, symphysis and your body. So these are just examples for showing you how functional matrix works. The one on the left and the right is just bond modification, or how the body adapts to the environment. So earlier, when compared to the genetic, now we know that the environment also plays a crucial role in growth. So that is just an overview of growth and the theories of growth. Thank you.